ready to share treatment tips with those who care at the Caregiver Call Center.
Hey, I got a message.
Hey there. My loved one is just starting EPIDIOLEX, and I'm a little overwhelmed between dosing and insurance. Is there anyone who could help me navigate it all?
Yes, I have great news for you. There's a group of people, and that is exactly their job, is to help you. They're called the JazzCares Nurse Navigators. And one of them is available for a call right now. Hold on. Liza? Hey, it's Greg. How are you?
Hi, Greg. I'm great. I've been waiting for this conversation.
Oh, you don't have to lie. I'm excited to talk to you. Listen, I hear that you help caregivers, and that gets me really excited. So let's just get right into it. What do you and your team do?
Well, JazzCares Nurse Navigators are here to help caregivers and their loved ones set personal goals and stay on track with their treatment.
Okay, so how do you do that?
By checking in along the way to keep them motivated, evaluating their progress throughout, and helping them address practical challenges they might experience when taking EPIDIOLEX.
Well, hey, it's always good to have goals. Is there anything else that you do?
Most definitely. We help ensure caregivers have the information and tools they need when they start and throughout treatment.
Okay, what kind of information are you talking about?
Oh, lots of kinds. Information about dosing and titration, how to administer their medicine, what to expect when starting EPIDIOLEX, and how to help manage side effects. Of course, the caregiver or patient should always be speaking with their doctor about these topics throughout their treatment.
Is there anything else the caregivers can turn to you for?
Absolutely. We can help navigate insurance changes, annual plan re-enrollment, or transition periods that could affect their insurance coverage.
That right there is so important and so hard to navigate on your own. I know that from personal experience, so I'm so happy that you have a team of people that know exactly what they're doing. It sounds so helpful. Now, if you could tell someone one more thing about Nurse Navigators, what would you tell them?
I'd say we're always looking forward to meeting new caregivers and patients who've started EPIDIOLEX, so we can help them as much as possible, as soon as possible. And just know we're here for you. You can call us and we'll listen to what you have to say.
No one loves a pep talk more than me. I am the pep talk guy. Most importantly, how does someone reach you?
Super easy. Visit the link below or call 833-426-4243.
Well, from one person who cares for caregivers to another person who does it for a living, I just want to thank you so much for everything you do.
Thanks, Greg. We'll talk to you later.
All right. Goodbye. Starting any new treatment can be an adjustment, but that's exactly why Nurse Navigators are here to help. So click the link, make the call now.
Important safety information and indications. What is the most important information I should know about EPIDIOLEX? Cannabidiol. Do not take if you are allergic to cannabidiol or any of the ingredients in EPIDIOLEX. EPIDIOLEX may cause liver problems. Your doctor may order blood tests to check your liver before and during EPIDIOLEX treatment. In some cases, EPIDIOLEX treatment may need to be stopped. Call your doctor right away if you start to have any of these signs and symptoms of liver problems during treatment with EPIDIOLEX. Loss of appetite, nausea, vomiting, fever, feeling unwell, unusual tiredness, yellowing of the skin or the whites of the eyes, jaundice, itching, unusual darkening of the urine, right upper stomach area pain or discomfort. EPIDIOLEX may cause you to feel sleepy, which may get better over time. Other medicines, for example clobazam, or alcohol may increase sleepiness. Do not drive, operate heavy machinery, or do other dangerous activities until you know how EPIDIOLEX affects you. Like other anti-seizure medicines, EPIDIOLEX may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your doctor right away if you have any signs of depression or anxiety, thoughts about suicide or self-harm, feelings of agitation or restlessness, aggression, irritability, or other unusual changes in behavior or mood, especially if they are new, worse, or worry you. Take EPIDIOLEX exactly as your doctor tells you. Do not stop taking EPIDIOLEX without first talking to your doctor. Stopping an anti-seizure medicine suddenly can cause serious problems. What else should I know when taking EPIDIOLEX? The most common side effects of EPIDIOLEX include increase in liver enzymes, sleepiness, decreased appetite, diarrhea, fever, vomiting, feeling very tired and weak, rash, sleep problems, and infections. EPIDIOLEX may affect the way other medicines work, and other medicines may affect how EPIDIOLEX works. Do not start or stop other medicines without talking to your doctor. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and cannabis-based products. What additional information applies to women? If you are pregnant or plan to become pregnant, EPIDIOLEX may harm your unborn baby, and medicines like EPIDIOLEX may be passed into breast milk. You and your doctor will decide if you should take EPIDIOLEX and about the best way to feed your baby while taking EPIDIOLEX. If you become pregnant while taking EPIDIOLEX, discuss registering with the EPIDIOLEX Pregnancy Surveillance Program, 855-272-7158, or EPIDIOLEXPregnancyStudy.com, and the North American Anti-Epileptic Drug Pregnancy Registry, 888-233-2334, or AEDPregnancyRegistry.org. The purpose of these registries is to collect information about the safety of anti-seizure medicines during pregnancy. What is EPIDIOLEX cannabidiol? EPIDIOLEX is a prescription medicine that is used to treat seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, or tuberous sclerosis complex in patients 1 year of age and older. It is not known if EPIDIOLEX is safe and effective in children under 1 year of age. Please read the EPIDIOLEX medication guide and instructions for use for additional important information. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Jazz Pharmaceuticals at 1-800-520-5568.